right, well, this is going to be a first. I'm going to try doing a video update for COVID-19. This is going to be hopefully a little more useful than what I'm used to writing up for what we're going to be talking about here. I'm still doing a write-up where I'm going to dive into a little bit more math and a little more study of the outbreaks, but I thought it would be nice with all of the news reporting about surges in cases and hospitalization going up to help put everything in perspective. So what I have here is all of the hospitalizations, daily active hospitalizations for every state in the US over the entire course, since March, over the entire course of the pandemic. Um, I got all of this data from a website called the COVID Tracking Project. You can see here they've got pretty good data. Normally, I don't like to use third-party sources like this. I like to get my data directly from the public health departments of the different states. But because they've got it all conveniently organized here, all in the same format and easy to download data, I figured for our purposes, it's good enough. So we've got every state here, and you can download this data yourself. You can do everything that we're looking at now, you can do yourself at home. So let's give this a shot. We're going to look at each state one by one. We're going to look at their entire trend over the course of the pandemic, leading up to last week. And then maybe if folks are liking this, maybe I'll do some of these a little more often, where we'll keep ourselves updated on what each of the states are looking at. So you can see these big peaks up here. Orange, that's New York. Green, that's New Jersey. Those were really the big two. They were the ones that peaked back in April with the most hospitalizations. And you can see this line up here. What I did was I normalized the number of hospitalizations to the population. So this 0.001 here, that means 1 out of every 1,000 people is this line here. So you can imagine when you've got 0.1% of your population, of a state population in the hospital, that is a huge number. That is very overwhelming. When I was listening to reports from hospitals, the kind of patient load you're talking about here, up here at this peak, we are talking about if you've got a 600-bed hospital, 500 of those patients were COVID patients. To give you an idea, so we're talking here at this point, hospitals where 80% or more of their beds were occupied by COVID patients. We were emptying out the hospital beds, or we were emptying out patients that were not COVID patients and putting them in other areas. Like the big ship that they brought, the military ship that they brought for housing patients, setting up field hospitals, stuff like that. So that is the overwhelming situation they were dealing with there. And to make it worse, this isn't even an accurate reflection really of the total number of patients that were coming in relative to other times, because patients were coming in and dying the next day. What was happening over here is the outbreak was so bad that the instructions were stay home unless your symptoms get really bad or you're in a really bad condition. So as a result, you had patients coming in that were really dying the next day, that they weren't even lasting very long in the hospital. And that's the only reason why these numbers didn't go even higher. It's because the patients weren't surviving very long. And we realize now that we weren't treating the patients with the proper treatments. It would have been much better to be putting them on blood thinners than putting them on ventilators. And so it was after this, really towards the end of April, where we really had a much better understanding of how to properly treat patients. And that's part of the reason why we're able to keep our hospitalization numbers lower later down the road. But you can see kind of our big numbers over here. We've got New York, New Jersey, also up here significant. We've got Massachusetts. We've got, this is Washington, D.C. over here. Let's make these numbers, so that here's Connecticut, you can see here. Washington, D.C. Now, when you see something like this, where you've got that big gap there, it's because a lot of our data is incomplete. We don't always have the best quality. Your data set's as good as the data that's provided. So on some days, we just don't know how many people were in the hospital. So we're kind of guessing, and for some places it's left blank. It's not that there was random days where there were zero patients. It's that we don't have the accurate numbers. So, what can you do? Other states in that area, like you can see Delaware in comparison to what New York and New Jersey were looking like. Um, Other ones that got hit early on, Illinois, you can see that was also one of kind of the worst hit areas. You can see starting in April is when we start to actually have hospitalization data for them. And you can see now towards the end, where we are at now, all the way over here in October, you can see the numbers are starting to trickle up a little bit, right? They're getting back up to maybe like about 0.002, something like that. So not as high, maybe like half the per capita hospitalizations that we had at their peak in May, but trickling up. So we want to keep an eye on. That's in comparison to, say, let's go down here to New Jersey, right? So you can see a peak up there, and they're not they're creeping up a little bit, but not as much as others in the current increases. We take a look at New York here. You can see also they're trickling up a little bit now in October, but nothing remotely close to the kind of patient loads that they were dealing with early on. So that's where we're looking at in terms of kind of those early hit states. Now compare that to, say, California. This is what California was looking like in the beginning. And California was one of the early warning areas, right? We were getting cases back in late February, early March. California started shutting things down really first before anyone else here in the Bay Area. We were mid-March is when we were starting to just shut things down. So you can see that compared to the other early hits, the other earlier hit early on, that was Washington, right? Those Washington nursing homes also had a big reputation of getting hit. And you can see Washington, other than that initial scare that we had there, hasn't really been hit significantly. So that's kind of the initial areas that were hit. After that, you kind of have your mid-range that started getting hit partway through. So let's take a look at, say Arizona. Like, right, Arizona is like a classic one. You can see where they were peaking partway through here. And this peak here in July, this was a tough peak to manage. What we were doing here is both Arizona, Texas, those types of states, we were shuffling patients around. We were moving them around in hospitals to manage the load. So that now when the hospitals were filling up over here, so you can see Arizona hospitals filling up quite a bit. Here in California, peaking around the same time. Most of our cases around here at that mid July peak, those were mostly in Southern California. And so it may not look like a lot compared to New York and New Jersey, but this was bad enough here at the peak in California that they were actually from Southern California sending their patients up here to us in the Bay Area. So a bunch of our hospitals up here in the Bay Area, we had a handful, 4 or 5 patients at each hospital that were actually Southern California patients that we were handling as kind of overflow. It's one of those tricks you can do when you've got one area that's hit bad and other areas that aren't. It's not ideal. You don't want to do that, but it's a trick that you can use. Others that were hit around that time, Texas was another one that got a lot of reputation, right? So this is where Texas was peaking. So a little less than Arizona when you're talking per capita, a little bit more than California, but it was certainly enough to create the need of sending patients to other hospitals. And of course, Florida. We got to take a look at Florida here. This is Florida. So you can see how bad the data was. Florida was. I was trying to, when we were first starting to look at Florida, I was trying to get the data directly from their public health website, and it was just a mess. They did not have a good data going into this. Now they're getting a little bit better, but you can see their peak there around the same kind of levels that we were looking at in terms of Arizona. So what kind of hospital-wise, we are talking here 20% of your patients in your hospital at levels around here were COVID patients at this kind of stretch. So it's not like over here where it's like 500 out of 600 of your patients were COVID patients. Over here it was more like 15, 20%, and a lot of the bad hit hospitals, which is a lot. And I think this is one of the things that we have to highlight because we don't realize normally a hospital does not have 20% of their beds unoccupied, right? A hospital needs to keep their beds occupied, otherwise you've got a bunch of extra beds that are just sitting around there doing nothing. So you're not used to, for an extended period of time, having 10%, 15, 20% of your patients in your hospital having a very contagious respiratory virus, right? It's not sustainable for long periods of time. And that's one of the things that we have to keep in mind, that you can't handle hundreds of people showing up in the hospital all at once, all needing serious respiratory care, right? It's a challenge. So that was kind of like our middle peak area around there. So you can see a lot of here's Georgia. I know there was a lot of talk about Georgia around there. Never really got as bad as say Arizona or Florida, but they were challenged up during that time. This is Hawaii. Hawaii peaked much later. So let's maybe go down the list. This is starting off here. Here's Alaska. So you can see Alaska never really became very significant. The numbers that we're looking at now, pretty low. Here's Alabama. Alabama was peaking around the same time as, say, Texas, Florida, Georgia, California, around that same time. These were all the places that started having that mid-June increase that peaked around late July. Here we've got Arkansas. Arkansas is one of the ones that we want to kind of keep an eye on the next couple of weeks. You can see they don't really have a surge. They've just been slowly creeping up over the course of this whole pandemic. So it's something that we're talking a lot about spikes and surges and this or that, but you also have to watch out for the slow and steady increases that just eventually get to the point where it's becoming too much for your hospitals to handle. American Samoa, nothing happening there. So Arizona, we got California, we talked about. You can see we're kind of we're staying low and stable here in California. So let's see if we can keep that going a bit longer. Colorado, not really anything interesting. We got a little uptick now, not even as much as they had back in April, and even in April they really didn't have, nothing compared to the other spikes that we were seeing back then. Connecticut hasn't really gone up significantly since that original spike. Trickling up a little bit, but it's of the increases that we're seeing now, it's kind of on the low end. Washington, D.C. has stayed pretty stable since that initial peak that we had. Delaware, not a whole lot interesting going on there right now. Florida's dropped down, flattened out a bit. One thing that we want to keep an eye on, and I don't think anyone's talking about this. This is Guam here. Which is a U.S. territory, right? These are folks that we got to watch out for too. That's actually the biggest increase that we're seeing right now, even though I don't think anyone's talking about it. But Hawaii, nothing interesting happening there right now. Their hospitalizations going down. Idaho, been pretty flat. Definitely not a surge happening there at the moment. They trickled up a little bit back in July and have stayed fairly stable since. Illinois starting to creep up. Indiana, same as Illinois, so here's Illinois here, here's Indiana here. You can see also they're starting to trickle up around the same hospitalizations per capita there. Kansas, nothing. They've been fluctuating in terms of hospitalizations. You can see when it's jumping up and down like that, means the data quality really isn't that good. You're not going to have the patients changing that drastically in the span of one day. That just means that some days you have better reporting than others, and it's not as good data quality. So their situation there might be a little worse than what it looks like from this data just because of the poor quality, but it's probably not as bad. Kentucky, again, nothing, no spikes, no surges. Slow and steady trickle up. You can see that trend over the whole time here there. So it's one of those things where you can handle a slow and steady increase up to a point, but then eventually even a slow, steady increase starts getting a little bit too much to handle. Here's Louisiana. Louisiana is really the only place. You can see that's the outlier in terms of having multiple peaks, right? Everything else, it really just has one peak. Well, Louisiana and Guam, right? Everything else really just had one peak, drop down, and there's really nothing else that's happened yet that could really be called a peak. Louisiana has been one of the worst hit states. I'd say they're probably in like the top 6 or something like that in terms of how bad they've been hit. Um, Massachusetts here, you can see again initial spike and then drop down, been pretty stable since. Maryland, again, not as bad as Massachusetts for that initial spike, and then they've been staying pretty low ever since. Maine never got interesting. Maine really never saw anything significant happening there. I find that very interesting. Gonna be interesting to keep an eye on this going forward. Michigan, you can see their initial spike, and they're trickling up a little bit now, but not a whole lot. Minnesota, it's one of the ones that they're talking about keeping an eye on right now. So you can see they're trickling up now, but nothing compared to what we're seeing in some of the other places. This is Missouri. Missouri data has been pretty bad throughout all of this. You can see that it's pretty unreliable data. Their cases are they're probably in terms of hospitalizations per capita, they're on the higher end of where the U.S. is right now. I think the only ones really that are beating them are the places that are really seeing a significant uptick right now, places like South Dakota and North Dakota. Um, uh, so here's Mississippi. You can see they were in that July uptick that went up in July and then have dropped down. They're still, as far as the U.S. average goes in terms of hospitalizations, they're still kind of up there. You can see out of how all the states are doing. This is kind of the upper end of hospitalizations, and your lower end down here. Montana's one that we want to keep an eye on. You can see this is a pretty steady increase that they've had ever since September. And it's one of those things where you can handle a certain increase, but you don't want it to keep going. North Carolina stayed pretty flat this whole time. North Dakota. Now you can see North Dakota is one that we're worried about right now. You can see how those numbers have been increasing lately. Nebraska increasing. Again, not on the upper end of where the states are right now, not as bad as, say, North Dakota or South Dakota. New Hampshire, like Maine, nothing interesting ever happened in New Hampshire in terms of cases and stuff. New Jersey, New Mexico over here. Again, one of those ones that really we haven't seen anything significant over the course of, nothing really significant happening over the course of New Mexico. Nevada, here you can see they were in that June, July uptick, kind of levels close to what we were seeing for Texas and Florida and those types of states. Ohio, not a lot interesting happening in terms of Ohio. They've stayed pretty stable since this began. Oklahoma, that's one of the ones that's not really a surge, but you can see it's been a slow, steady increase really ever since June. And it's gotten to the point where now, in terms of hospitalizations, they're kind of up there. Oregon, interesting. Nothing interesting really seemed to happen in Oregon in terms of cases. They've stayed low and stable throughout this whole time. So we'll keep an eye on them. This is Pennsylvania here. They were part of the initial uptick, and then haven't, again, seeing a slight increase now. Not as big as what they had originally, but you can see the increase happening now. Puerto Rico, no surges or spikes happening there. They had their uptick around July, and they've kind of stayed at that level, kind of the middle of the road compared to the rest of the U.S. in terms of hospitalizations. Rhode Island here, you can see they were part of that initial surge, and then they've stayed fairly stable, starting to uptick a little bit now in terms of hospitalizations. South Carolina, they were part of the mid-July, the July upswing, and they've stayed pretty stable since dropping down from then. South Dakota, right? That's what everyone is talking about right now in terms of their increase. And you can see there's a very interesting 1 month lag between when they had that big motorcycle rally, shindig, whatever you call it, and when they really started seeing a change in their hospitalizations. So it'll be interesting to see how much of this is really a sustained increase and why was there a 1 month gap between when their cases started going up and when the hospitalizations going up. It's possible that you had your initial infections were hitting your low risk population, and then from them it spread to your higher risk population that's actually ending up in the hospital. And that might be what was happening in a lot of these surges that we weren't catching. It's possible that we had a lot of undiscovered cases originally that eventually turned into increased infections in your high risk patients that were going to show up in the hospitals. So let's keep an eye on this and see how it's going in the future. You can see they're kind of leading the pack right now in terms of per capita hospitalizations. Tennessee here you can see stayed pretty. They're on the higher end right now in terms of hospitalizations. They've stayed pretty stable since July. Texas over here, you can see they're starting to go on an upswing now in terms of hospitalizations. Not as much as what they had when they were peaking, but they're kind of getting up there. A lot of talk about Utah lately. I saw in the news, and of course, Utah doesn't look very significant when you're looking at it this way. But here's the challenge: those hospitalizations you see there, those are almost all in one area. It's all around the Salt Lake City area. And that's part of your problem is when all of your cases pop up all in one spot, even if you're doing your per capita per the entire state, if the rest of the state's pretty empty and they're all in one places, it starts becoming difficult to manage that many sick patients all at once, right? Virginia, in terms of per capita, they've stayed pretty stable throughout this whole thing. No surges, no spikes, no significant drops. Virgin again, small territories. This is the Virgin Islands here. Nothing happening there. Vermont was one of those states that really hasn't seen anything going on. They've stayed low this whole time. Washington also stayed pretty low, other than that initial scare that we had. Nothing really interesting happening there. Wisconsin, that's one of the ones that's got that uptick, right? So here's per capita hospitalizations in Wisconsin. I was listening to some updates with some Wisconsin hospitals earlier this week, and they were saying in terms of their hospitalization usage, they're talking about you got a 600 bed hospital. That one was sharing a 600 bed hospital, maybe like 40 patients they've got there that are out of the 600 that are COVID patients. So it's and that may not seem like a lot. That's less than 10% of their patients that are COVID patients. But keep in mind, there's a limited number of beds in a hospital, and they only have room for so many, right? You've got other diseases, other patients that need hospital beds. So you don't really want to get to the point where you really have to coordinate with other hospitals to manage your load. That's what they're doing right now in Washington. The hospitals are coordinating with each other, and those that are running low on beds, they're coordinating with ones that have more bed space, and they're shifting patients around. And you can do that. It's not ideal. You don't want to keep doing that for a long period of time. West Virginia stayed pretty stable since August. Nothing interesting happening there right now. Wyoming, a little bit of an uptick, I guess. They've stayed pretty low and stable this whole time. But that's what we're looking at in terms of our hospitalizations for the country. So you can see a lot of states on the uptick right now. Some we're going to want to keep an eye on more than others. Some of them, I mean, the uptick, take it in context. If you've got a little increase over here, it's not the same as when you've got a drastic increase like something up here. Now we also here, I created a chart, also from the COVID tracking project website, that's also fatalities. So these are deaths. And what I did, because deaths are a more difficult data point to deal with, it's much less stable, I did a 7-day average. And that's when you take 7 days, you average, instead of how many people died on a single day, you average 3 days before, 3 days after, and you take that average and you plug it in for that day. And so it's a 7-day moving average. It smooths out your data a little bit more. And then, of course, again, I normalized it to population. So you can see the big peaks early on: New York, New Jersey, Connecticut, Massachusetts, those types of states that were peaking early on. And so one of the things that you want to keep track of over here is are there states right now where the deaths are actually increasing? Because a lot of people are just comparing our deaths now to our deaths over here and saying, oh, deaths are decreasing. And that's not really a proper comparison, right? Because deaths could be increasing during this period relative to this period over here, even if they're lower than what we had originally, right? So nothing is looking like it was back in April, and that's what everyone's worried about, right? No one wants to see this again, where patients are showing up in the hospital and dying the next day, and you're running out of PPE and all that stuff. So very quickly, let's just run it. So like this is Alaska here, Alabama, Arkansas. So I do want to point here. You see how you got that big spike there in mid-September. That's not actually a major spike in deaths. What's happening there is they realized that they were undercounting deaths from the previous couple of weeks or couple months, and they're adding them all in there. So it's not that a ton of patients died all at once there in September. It's that they are adding the numbers in. It's one of the reasons why I don't really like fatality rates, because you tend to get those weird random spikes when they make adjustments in the data. So you can see here's Arizona there, California. Even during that surge, we were not seeing a lot of fatalities in California. And maybe in my next update, I'll dive into a little bit of some of the theories as to why that is. Here we got Colorado. So you can see Colorado, there's a couple days where the deaths go negative, right? You see that in May. And that's actually because they were overcounting deaths during previous days. So they throw in some negative deaths in there to adjust for when they were overcounting. So I know there are some people that are saying, oh, we're not properly counting our COVID deaths, and it's people that were dying for other things, and they had COVID, so we marked them as a COVID death. And that is happening a little bit, and we are retroactively going back and adjusting data as needed to make up for those types of discrepancies as much as we can. So here you can see Connecticut, Washington, D.C., Delaware. Again, you can see that big peak in the middle there in July. That's not a big surge in death. That's going back and retroactively adjusting your fatality numbers to more accurately reflect how many people had died in the previous couple of weeks. Florida, they trickled up, and then they've been slowly dropping down since. Guam, interesting that even though we're getting a surge now in hospitalizations there, it's not yet showing up in that fatality data. They've stayed pretty stable, although still on the higher end compared to the rest of the states in terms of case fatality rates there. Hawaii, low and stable. Iowa, trickling up a little bit, nothing drastic there. Here we got Idaho staying low and stable there. Illinois, maybe a slight uptick. Hard to say yet. We'll have to keep an eye on that next couple of weeks and see if there's a significant increase there. Indiana, we are seeing a bit of an uptick there in terms of fatalities. Let's follow that the next couple of weeks, see what we see. Kansas, maybe an uptick. Let's keep an eye on that, see what those numbers look like. It's kind of hard to tell. It looks like they're trickling up there in terms of fatalities. Kentucky, it looks pretty. Yeah, let's see what the next couple of weeks look like for Kentucky there. Massachusetts, no real increases since that initial spike that they had there. Maryland, nothing interesting happening there, staying low and stable in terms of fatalities. Maine, definitely nothing happened there, either in terms of hospitalizations or fatalities. Here we've got Michigan, maybe a slight uptick compared to August or September. So let's see. Let's again, most of these states, let's keep an eye on the next couple of weeks and see if we're really getting an increase in fatalities or it's just a little noise in the data. Minnesota doesn't really look like much in terms of an increase in fatalities there yet. Missouri has been fluctuating. I think really this is more of a function of bad data than it is an actual fluctuation in case fatalities. I think they're just not doing a good job of reporting their data, and so they have some days where they're reporting more. They're reporting the deaths from the previous couple of days, and then some days where they're not reporting. So it's more likely what's happening there. Mississippi, they're kind of on the downtick in terms of fatalities. Montana, they're starting to trickle up. So remember, we saw that Montana, in terms of hospitalizations, they are one of the ones that's really more on the uptick. And now it's starting to show up in their fatality data. Now they're starting to get more patients dying. North Carolina, nothing interesting happening there. North Dakota, there you can see their fatality rates are starting to increase in proportion to how the hospitalizations are also increasing. So there's a pretty predictable lag period of maybe about 2 weeks, 3 weeks between when your hospitalizations start going up and when your fatalities start going up. And so that's starting to show up in a couple of our data sets now. Nebraska, starting to see hints of an uptick, I think there. Let's keep an eye on that the next couple of weeks, see what happens. New Hampshire, nothing interesting there. New Jersey, nothing interesting there. New Mexico, nothing interesting. Nevada, they're still on the downswing in terms of fatalities. New York, staying flat this whole time. They've really had nothing since that original surge. I mean, they've had a bunch of days all throughout this time with zero. They've gone multiple days without any COVID deaths. So Ohio, they've stayed pretty low and stable this whole time. Oklahoma, not really noticing an increase in fatalities yet. But again, looking at their hospitalization rates, they were more of a slow and steady increase. So maybe that's going to be more of what we see in the fatality data too, a slow and steady increase. Oregon stayed flat the whole time, nothing interesting happening there. Pennsylvania, you can see, again, staying low and flat ever since that initial surge they had. Puerto Rico, pretty low in terms of fatalities there. Rhode Island, been staying pretty flat ever since that initial surge there. South Carolina, I don't think I think that's more fluctuation there. I don't think we've got an uptick there. Let's keep an eye on it. South Dakota, you can see their fatality rates starting to go up, corresponding with the increase in hospitalizations that they've had there. Tennessee staying pretty stable over the last couple of months. Some fluctuations, but nothing interesting happening there. Texas, they've leveled out since that initial peak that they had. Utah, they've had in the last couple of weeks more fatalities from this. Let's see if that increases drastically more in the future. I don't think we're going to see a drastic increase in their hospitalizations. They look like they're, in terms of fatalities and hospitalizations, I think they're really leveling out over there. Virginia stayed pretty low and stable throughout this whole time. Virgin Islands, not a lot. I mean, it's a very low population there. Not a lot of people even to get infected and die from it. Vermont, this is very interesting. Really, I mean, they've had low cases and low hospitalization rates, but really no deaths at all there in Vermont. Washington, low and stable this whole time. Wisconsin, you can see their fatalities are starting to trickle up there. And West Virginia, staying stable. Nothing interesting happening there. Wyoming, let's keep an eye on it the next couple of weeks and see what happens. So you can see, looking at the hospitalization data and looking at the fatality data, there are places that are going down. There are places that are going up. The ones that are going up, and I still see people asking this, is the reason that we have cases now is because we're testing more. And that's not, I mean, the reason why we have more diagnosed cases now compared to here is because we're testing more. All right, we're testing way more people now in October than we were testing here in April. But when you see your hospitalizations go up and you start seeing your fatalities go up, that's because you actually have more infections and it's actually spreading in those areas. And you can see it's mostly spreading in areas that have not had a significant wave up until this point. We have yet to really, other than Louisiana, we have yet to really see a significant wave in a state that's already had one major wave. But let's keep an eye on it in the future and see what happens. So that's a crash course through our hospitalization and fatality data. So if people are asking you, if you're having conversations about whether the cases are going up or down, or whether hospitals are swamped or looking good or bad, you can kind of use this this data to accurately assess how bad things are going. And you can download all this data yourself. You don't have to take my word for it. And maybe I'll put together some more updates later that are video updates where we just look through the data together and put all of it in context, in perspective of what's happening. So hope everyone's staying healthy, taking calm, reasonable precautions, being mindful of the areas where you've got increases. When you've got increases in a spot, you want to kind of avoid large gatherings, large events. Um, so be responsible with yeah, yeah, responsible in the decisions we make. So that's it for this one, and hopefully I'll get a nice written analysis up soon.